Today we are starting pharmacology. We will discuss general pharmacology. In this lesson we will discuss branches, and if you want to clear your concepts, listen to this lecture carefully. You will learn and understand these terms in this lecture if you concentrate. We will discuss the following in this lesson: pharmacology, drug, pharmacokinetics, pharmacodynamics, toxicology, therapeutics, posology, chemotherapy, and pharmacogenetics. As you know, the living body comprises of cells, molecules, organs, and organ system. The branch of science that deals with the drug interaction with a living body at all levels of organizations, that is molecules, cells, organs, and organ system. It is derived from a Greek word pharmakon, that means drug, and loga, which means the study of drugs. What is drug? Drug is derived from a French word drogue, a dry herb. Drug is defined as any substance used for diagnosis, prevention, relief, or cure of a disease in human being. Next important term is pharmacokinetics. What is pharmacokinetics? It is a branch of science that deals with the absorption, distribution, metabolism, and excretion of drugs. Another important branch is pharmacodynamics, the branch of pharmacology that deals with the study of mechanism action of the drugs and various factors which influence drug action. The important question is, what is the difference between pharmacokinetics and pharmacodynamics? The difference between pharmacokinetics and pharmacodynamics is that pharmacokinetics is the movement of drugs through the body, whereas pharmacodynamics is the body's biological response to the drugs. Pharmacodynamics is the body's response to the drugs, and pharmacokinetics is the movement of drugs through the body. You have to clear your concept here about the difference between pharmacokinetics and pharmacodynamics. Listen these two slides clearly and understand the concept, because it is very important question in the exams. What is toxicology? The traditional definition of toxicology is the science of poisons. The more descriptive definition of toxicology is the study of adverse effects of chemicals or physical agents on living body. It may also be defined as the branch of science which deals with the recognition, mechanism, prevention, and treatment of harmful interactions between chemicals and living tissue. Therapeutics is also an important term. It is the art and science of treatment of disease. It comes from the Greek word therapeutikos, which means inclined to serve. Therapeutics is treatment and care of patient for the purpose of both preventing and combating disease or alleviating pain or injury. Pharmacotherapeutics deals with the proper selection of drugs and use of the drug for prevention and treatment of disease. The science of dosage or posology is a branch of pharmacology and therapeutics concerned with the treatment dosage or dosage regimen. It comes from the Greek word posos, which means how much, and logos means study. In simple words, you can say it is a branch of pharmacology that deals with the doses of drugs. Chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. Pharmacogenetics, or sometimes also called pharmacogenomics, is a branch of genetics that studies the genetically determined variations in responses to the drugs in humans or laboratory. These are the important branches of pharmacology, and thank you for listening to this lecture.